attention enough. Shall I start the class? You do it, sir? Alright. Yes, by saying exam. Practical file. Practical MST might be in the next week. I will let you know because I didn't get my dates. I will let you know. Timetable. Alright. So, let us see here. Today there is a very interesting thing. Let us do a quick revision. So, how many tests we completed so far? ABO, ESR, HB estimation, DLC, very good, and TWDC, and TRDC. By the way, do you have all these practical notes with you?
Yes, sir.
Your regular notes, okay? Don't blame about lab manual. If we go with lab manual, we need to clean glassware every day. You have seen, right? So yes, that's why we are proceeding with this. Next one. Today I will discuss another interesting practical, that is bleeding time. Okay? And of course we also take PBS. You need to do practical students every day. Then only you will be become skilled at them. Anyway, now listen. Bleeding time. So it looks like a very simple test, but it has a huge significance in the medical care. Okay, I will let you know what is bleeding time, what are the aspects, everything we'll see. But lab test is very simple. Okay, let us see what is bleeding time. Can you guess what is the meaning of bleeding time? Definition. What do you mean by bleeding time? Yes? Yeah, very good. See, upon getting an injury to you, okay, traumatic injury to your blood vessel, you started bleeding, right? From the time of bleeding, or I can say like this, / puncture to the blood vessel. From the time of bleeding or puncture to the blood vessel, till the time of arrest of bleeding. At one particular time, maybe after 2 minutes, this bleeding will be stopped, right? Till the time of arresting of bleeding. Arresting / stoppage. Stoppage of bleeding is called as bleeding time. Clear? Now listen, there is a difference between bleeding time and clotting time. Don't get confused. Can anyone tell me what is clotting time means? How clotting time is different from bleeding time? Yeah. Very good. Any others? Internationals? What do you mean by clotting time? Ria came close. Ria gave a proper definition, but still I need a more refined definition. Any others?
Time taken to make clot.
Very good. Now Simran, right? Simran giving time taken for the blood to clot. Right? That is also correct statement. Both are correct. So time taken for the blood to clot means fluid state blood should be converted to semi-solid state. That is called as clot. The time taken for the blood to clot is called as clotting time. Clear, right?
Yes, sir.
This is clotting is different from bleeding. Keep in mind. You might stop your bleeding, but you might not clotted. Blood might not clotted yet. Just a stoppage of bleeding doesn't mean clotting. Clotting takes some more time, right? Or I can say very simply, after your cut, what happens? You will bleed. After bleeding, you might wipe it. Then you will see a small waterish formation. It's some glue-like waterish formation. That I will let you know. So there you are stopped. Your bleeding has been stopped. But if you tap the surface again, you will bleed again. Am I correct? After that transparent liquid came, if you tap it again, you will bleed. But after maybe half an hour, you will see a black plate formation. That is a clot, right? So if you remove the clot again, you will bleed. That you can understand. So let us see what is that, and very interesting things happening in the body, and I will let you know how to start this story. So I have one good analogy to tell these two phenomena. Imagine students, everyone imagine, behind this wall, maybe in the next lab, there is a huge water tank, a very big water tank. Entire room was filled with water. Clear? Now, some of you, maybe Pradeep got angry on me and he hit the wall. Okay? He hit the wall and 2 bricks has been removed. 2 bricks has been broken. Now what happens now? Immediately the water will rush out from this hole. There is a hole in the wall. Am I correct? So now few bricks has been removed and water started flowing, that is bleeding. Now what we will do means, in this scenario, I will bring somehow 20 bricks and I will keep bricks here. I kept 20 bricks here to stop the water flow. Is it clear? Now, keeping bricks is a temporary solution. If we remove the bricks, again the water will flow. Here, the bricks are platelets. Platelets will temporarily stop the bleeding or bricks stopping the water flow. But is that the permanent solution? It's not permanent solution. What will be the ideal solution to this problem? Cementing. Very good, Simran. So you need to take the sand, cement, some water you will mix. Now you will cement the bricks. You will apply cement layer over the brick, so permanently they will be blocked. Cementing is the permanent solution to the break wall coming out of water rushing out. Similarly, in the body, everyone block his head now when I am explaining. So this is a blood vessel. This is a blood vessel. Now I just want to tell you, in case of cement preparation, we only have 3 ingredients. They are sand plus cement plus water. Right? Now listen, cement equivalent component in the blood was a formed cement, okay, a final cement, a tough cement, right? That is called as, that is, we are saying clot, but right term will be fibrin. Fibrin is just like a cement. Fibrin is just like a cement that will clot the blood. That is a permanent solution. But just like a final cement output, what we can say the final cement? Any idea? Hardened cement, maybe. Hardened cement, right? Yeah. Before hardening of cement, we have some raw materials, right? The raw material we have in the blood for fibrin is called as fibrinogen, the precursor. Fibrin generator, fibrinogen, fibrin generator. Okay. Now, just this fibrinogen can be stated as a powder cement, but just a fibrinogen alone cannot make a fibrin clot. It needs some ingredients. It needs some ingredients to convert this to fibrin. The ingredients are called as clotting factors. How many clotting factors we have? 13. In case of cement, we have only 3 ingredients. Here we have 13 clotting factors. We will see what are those 13. Can you able to recall all 13 clotting factors? Can you? Let us try. So I will let you know. Maybe I will tell clotting factors later. I don't want to make you deep again in the first phase. Anyway, is everything clear so far? Now you understood what is clotting, and now I will let you know what is bleeding with this story. Okay? So imagine a blood vessel. Blood vessel made up of cells. Can anyone say what are those cells? very endothelial cells actually, not epithelial, endothelial cells. So I am keeping endothelial cells here. See, all cells must have a nucleus. So endothelial cells, right? Blood vessel with endothelial cells. Now, any two cells are stitched together by a matrix substance in the body. Just like these buttons present to this shirt is like a matrix cloth, and these buttons are cells. In our body, that matrix is called as basement membrane or simply collagen fibers. Collagen is the ground substance where all cells are stitched together. Clear?
Yes, sir.
Now come back to this story. So our blood vessel was damaged with some prick. Okay? Some prick was damaged the blood vessel. Immediately after the damage, the collagen was exposed. Collagen was exposed. Is it clear so far? Blood vessel injury, exposure of collagen. Collagen was exposed. Finally, to understand this story, you should know three properties of platelets. Platelets has three important properties. This note is available in Chandigarh Physiology textbook. I will let you know what are the three properties. They are called as AAA. Triple A. The three properties of platelets are, write down, adhesion, ADHESION, adhesion or attachment, you can say, attachment, adhesion or attachment. Second property, aggregation, very good, aggregation. And third property, what? No, activation. Activation. What are these? I will let you know. I just want to add some more points here. Maybe shall I wait after this? What to do? I will write here glycoprotein 2B, glycoprotein 2B, 3A, then ADP, thrombexin A2, conversion of fibrinogen to fibrin. These are extra points I will let you know. See here, coming back to our story, we have a blood vessel damaged. Immediately after damage of blood vessel, what happened? Collagen was exposed. After collagen exposure, this endothelial cells will secrete a type of pseudo-hormone, a component, protein called as 1 milligram factor, BWF. Damaged endothelial cells will release 1 milligram factor, and 1 milligram factor will deposit on collagen, on exposed collagen. 1 milligram factor will deposit on exposed collagen. Is it clear? This 1 milligram factor was released by damaged endothelial cells. Damaged endothelial cells release 1 milligram factor. Okay? Now I will tell you a short love story here. 1 milligram factor marry one of the clotting factor. That clotting factor is called as clotting factor 8. I will let you know what is that. 8 clotting factor is called as anti-hemophilic factor. I will let you know what is this one. During the back days, if a person bleeding a lot, those persons are called as bleeding loving persons. The Latin word for this is hemophilia. Hemophilia means hemo, blood philia, blood loving or excessive bleeding disorder. We came to know that the persons who are having this excessive bleeding, they don't have this factor 8. Factor 8 deficiency lead to a severe bleeding disorder. Factor 8 deficiency lead to a severe bleeding disorder. Okay? And we came to know this factor 8 is responsible for prevention of bleeding. That's why we call factor 8 as anti-hemophilia factor. It will prevent bleeding. Anti-hemophilia factor. Clear? Alright. So a quick recap of the story. We got a blood vessel, damaged, collagen exposed, endothelial cells released 1 milligram factor, along with 1 milligram factor, factor 8 was deposited with 1 milligram factor. Clear?
Yes, sir.
Now, coming to our hero in this story. The hero was the platelet. A platelet was wandering in the blood vessel. Regularly they will wander. Right? Now, this platelet, once it is wandering, platelet has a affinity to BWF, 1 milligram factor. What platelet did? It identified exposed 1 milligram factor and it started attaching to the 1 milligram factor. This is the first property of platelet. Platelet attached to 1 milligram factor to the exposed collagen. Sorry. This attachment is facilitated by a receptor. There is a receptor that is facilitating this attachment. That receptor is called as GP2B. That receptor is called as GP2B. Clear? The platelet attachment, the first property completed. Platelet attached. Next thing. This attached platelet will release two important chemicals. ADP / thromboxane A2. What are these two things? Thromboxane A2 is like a biryani to the platelet. They love thromboxane A2. Once thromboxane A2 came, some thousands of platelets will aggregate in this region. Thousands of platelets will come towards this region because platelets have sensed thromboxane A2. They love thromboxane A2, that's it. So thromboxane A2 released and platelets got aggregated at the site of injury. That is the aggregation. The aggregation mediated by thromboxane A2 and any two platelets will connect each other by a component, by a receptor called GP glycoprotein 2B3A. With the help of this receptor, any two platelets will attach. That means aggregated. Aggregation. Aggregation is mediated by a protein called 2B3A plus a chemical called thromboxane A2, whereas attachment is facilitated by a glycoprotein 2B. Okay, and that's it. So far clear? So in this story what happened? After damage, bleeding started, platelets came, platelet attached, platelet aggregated. Now they made a temporary plug. This plug is called as primary platelet plug formation. Primary platelet plug formation. Primary platelet plug formation. Okay? This will prevent the bleeding. Once this primary platelet plug form, the bleeding will be halted. This is called as bleeding time. The stoppage of bleeding, right? Then, what happens in the next phase after this phenomenon? After this, these platelets will get activated. The third phase, activated platelet. Now in the circulation we have 13 clotting factors. They will start converting fibrinogen to fibrin, and fibrin will clot the, fibrin will make a mesh of fiber network over the platelets leading to clot. Fibrin clot. Clear? Now you understood what is a fibrin clot, clotting, right? Yeah. Now I need to tell you about clotting type also. Shall I discuss clotting factors here? Very simple. Write down this shortcut for understanding clotting factors. I'm not going to discuss 13 clotting factor names. I will make it simple. Keep in mind, clotting mechanism starts by two phases. Imagine, we have something called a prothrombin activator. This prothrombin activator will convert prothrombin to thrombin. I will let you know. Just imagine, if the blood vessel damaged, it will trigger a pathway called intrinsic pathway. Simple. That is what you need to remember. A blood vessel damage lead to intrinsic pathway. If a tissue damaged, maybe your knees, if a tissue damaged, this will trigger extrinsic pathway. Okay. Now, they will make a common substance called prothrombin activator. This prothrombin activator will convert prothrombin to thrombin. Now, this thrombin will convert fibrinogen to fibrin. This fibrin will be clotted. This is the simplest story. Okay. Now, if I embed all the clotting factors here, it looks like this. 12 converted to 12A. This 12A will be converts 11 to 11A. This will convert to 9 to 9A. Then this is a 10th clotting factor. So this looks complicated to you. I will give you a shortcut to memorize these clotting factors. Write down the shortcut. Very interesting shortcut. You must memorize it. That's it. Somehow. Let me keep camp here. Let it be. Yeah. Write down the shortcut for clotting factors. The shortcut goes like this: 12, 11, 9, 10, 2, 1. From 9, 7. In between 11 and 9, 8, and here 5. So see here, it's a gun. You draw this one, everyone. Draw this one, and I will let you know what is this. Listen now. Now listen. See, from 12 to 1, 12, 11, 9, 10 to 1, 8, 5. Okay. All these are intrinsic pathway clotting factors. See, 12, 11, 9, 10. Then these are 2, 1. So this is intrinsic pathway. These are intrinsic pathway. And extrinsic, including 8 and 5. Including 8 and 5. They are subfactors. There will be somewhere plus calcium. Okay. Now, extrinsic pathway is this one. Extrinsic pathway. Is 7, 9, 10 to 1. 9, 10 to 1 is the common pathway actually. 9, 10 to 1 will be common pathway. Okay. That is it. This is complete clotting mechanism and their pathways. Extrinsic pathway, intrinsic pathway, common pathway. Is it clear? No. See students, once the tissue damaged, immediately the 7th factor will be released. 7 will be converted to 7A. 7A will be converted to 10 to 10A. and they will go to common pathway 2, 1. This is the same 7, 9, 10 to 1. Extrinsic pathway clotting factors and intrinsic pathway clotting factors 12, 11, 9, 10 to 1. Okay. If you see the actual flow chart, you can understand this one. Now listen, important. I kept a gun-like structure like 7, 9, 10 to 1. I purposely kept a structure like that. These clotting factors are vitamin K dependent. Clotting factors. These are vitamin K dependent clotting factors. Now listen. If the patient has a vitamin K deficiency, the patient will have a clotting problem. The reason was these factors won't work without vitamin K. Vitamin K deficiency leads to increased clotting time. The reason you understand this. Got it? And now, vitamin K was extensively synthesized by liver. So if your liver damaged, your vitamin K synthesis will be nullified. Without vitamin K, these factors cannot be synthesized. If these factors are not there, your clotting time will increase. See how they are interconnected. Now, there is a beautiful oral anticoagulant. What are anticoagulants means? They will prevent bleeding, clotting, right? What is the normal anticoagulant we are using in the lab? PDTA. What is the oral anticoagulant we can use? Something that we can give orally to the patient. This anticoagulant will destroy the vitamin K, leading to non-clotting of blood. Can you guess what is that clotting that drug? That is warfarin. Warfarin. Warfarin is one of the potent oral anticoagulant. By the way, why we are keeping patient under warfarin therapy? Why we are ensuring that the patient blood should not clot? Why we are concerned about patient blood clotting status? Why we are prolonging it, by the way, by giving warfarin? Why we are destroying the vitamin K? Why we are not allowing blood to clot? Any guess? Why we given warfarin to the patient? Any idea why? Imagine a patient got a heart attack. One of the reasons for heart attack is blockage of coronary artery. Why coronary artery block? Maybe blood clotted in the artery leading to heart attack. Here the patient experiencing some internal blood clotting. The blood was clotting here. So we want to stop further clotting of blood. What we did? We given a warfarin. Now warfarin will destroy the vitamin K, leading to non-clotting of blood. So warfarin will be given to the suspected ischemic attacks. Ischemia means blockage of blood vessel. In such patients, we are giving this warfarin therapy. See, this bleeding, clotting, connecting many things in the body. Now, I will tell you another challenging problem. Very, very dangerous problem. Sometimes our little culprits, so-called platelets, without any blood damage, without any blood vessel damage, they will activate and they will convert fibrinogen to fibrin. Very, very dangerous phenomenon. Got it? Without any damage to the blood vessel, platelets will clot the blood, leading to multiple clots in the blood vessel. If this happens, game over. This multiple blood clots is called as disseminated intravascular coagulation, DIC. Once DIC triggered, the patient multiple organs will be failed and patient will die within a matter of 15 to 20 minutes. Intravascular coagulation, disseminated intravascular coagulation, DIC, dick formation, very, very, very dangerous. DIC form means game over. One of the area where we will experience DIC is incompatible blood transfusion. He is A positive, she is B positive. We given A blood to B, game over. Her A antibodies will attack his cells, leading to clotting of blood in her body. First she will experience DIC, she will collapse. There is something called anaphylactic shock. DIC leads to anaphylactic shock. This anaphylactic shock lead to death. I don't want to explain anaphylactic shock phenomenon, that is very big mechanism. Simply they will die. Okay. Yeah. So far clear, right? Now we are understanding clotting phenomenon. We understand the significant role of platelets. Am I correct? Now I will give you some case studies. Try to explain me what happens. Is it clear? Now listen. What is the normal platelet count in the body? Normal platelet count. 1.5 to 4 lakhs. Right? Now imagine. The platelet count is around 90,000. That means less than 1 lakh. What might happen to the bleeding time? What happens to the bleeding time? Tell me, students. Bleeding time will increase. Why? Huh? Why are you saying clotting now? Why decreased platelets leads to increased bleeding time? Explain me. Why? Very good. Since there are less platelet attachment, less segregation, and more bleeding time. We have instead of having 10 breaks, we have only 5 breaks, so we can't stop the water flow. Same experience, same phenomenon. Now, tell me in what conditions bleeding time will shoot? In what conditions bleeding time will shoot? Increase. Let us see. Obviously, one reason decreased platelet count is called as what? What is the medical term for decreased platelet count? Thrombocytopenia. Very good. Thrombocytopenia. Very good. Next condition. In any other conditions, bleeding time will increase. Vitamin K deficiency leads to increased clotting time. That is clotting factors. That is not about bleeding. Any other factors lead to this one? Tell me, students. Yes. Very good. 1 milligram factor deficiency. WBF deficiency. There are some inherited genetic disorder where these people don't have 1 milligram factor, leading to increased bleeding time. Any more? See, usually we will think factor means clotting factor deficiency leads to clotting time increase of clotting time. But there is one exception. Factor VIII deficiency also lead to increased bleeding time. What is the reason? 1 milligram factor married our factor VIII. They are always together. So factor VIII deficiency leads to both increased bleeding time, parallelly increased clotting time also. Right? Very good. Then, any other conditions where bleeding time will increase? Any other conditions? Yes, Melissa. Excellent. Melissa is the best, smartest student in this class. Very good. Very good. Yes. Platelet function problem. I will let you know. Here, there is a new case where we saw increased bleeding time in the patient. Then immediately we went for platelet count. And interestingly, platelet count came normal, 4 lakhs. Alright? Platelet count is normal, but patient experiencing bleeding time. So we suspected his VWF, 1 milligram factor and factor VIII. We assessed them and they are also normal. How is it possible? If VWF is there, if 1 milligram factor VIII there and platelets also normal, but still bleeding time shooted, maybe platelets are there but the receptors are deficient. That is another genetic problem. I will write down here. GP2B deficiency leads to a genetic disorder called as, write down, that disorder is called as I forgot the names, I will let you know. Gallman's thrombostheria, wait, Gallman's thrombostheria. Another one is I sincerely forgot. I know the answer, just a second. 2B3A deficiency. 2B3A deficiency. This is embarrassing. Let me see. Gallman's thrombostheria and GB deficiency. UIAHS. Yes, I got it. 2B3A deficiency is called Gallman's thrombostheria. Another one is called as Bernard-Solier syndrome. Bernard-Solier syndrome. 1B deficiency, attachment deficiency is called as Bernard-Solier syndrome, whereas 2B3A deficiency is called as Gallman's thrombostheria. Clear? Yeah. Next one. There are some more interesting things. In what other conditions bleeding time might increase? So I wrote here Gallman's thrombostheria and Bernard-Solier syndrome. Any other conditions? Guess. Guess students. Any other conditions leads to increased bleeding time? Yeah. How many of you know about
Pathology.
Talal? Yes, next one. How many of you know about leukemia? What is leukemia means? Tell me students. Blood cancer. So in leukemia what happens was, this is a bone marrow. In the bone marrow there are stem cells, pluripotent stem cells that will make blood cells. So there is a cancer to this leading to abnormal cell formation. So leukemia, what happens in leukemia? Platelet count will be reduced, leading to increased bleeding time. So in leukemia, bleeding time can increase. See, a simple increased bleeding time can lead to a cancer condition in the patient. Might be chance, right? So very important test actually. Next one.
This is actually, sorry.
Huh?
This is actually malaria or dengue means separate from.
Very good. In dengue. Not malaria,
Sorry,
in dengue that is
dengue
platelet. This dengue virus will attack platelets, leading to platelet deficiency, leading to increased bleeding time. Dengue, in dengue we will have this increased bleeding time. Any other conditions? Excellent, Shane. Hepatitis. That is a challenging thing. I can understand. She's trying to say hepatitis will destroy the liver. And the liver will secrete factor 8. Factor 8 deficiency leads to increased clotting time plus increased bleeding time. Yeah. So in one way that is connected, we need to cross-check clotting time also to know the hepatitis status with bleeding time. You understand the reason, right? Factor 8 deficiency also increases CT, clotting time. Parallelly, we need to check clotting time. If that is also increasing, definitely liver issue. Yeah, very good. Hepatitis might be a chance where liver was damaged. Very good. Any more? Now listen. If patient experiencing DIC, patient has multiple clots in the body. What happens to the bleeding time? Any guess? If there is multiple clotting, what happens to the bleeding time? It will decrease or increase? Actually, bleeding time will increase. I will let you know why. The platelets are diverted to the multiple locations for clotting. So platelets are less in the circulation. Decreased platelet in the circulation leads to increased increased bleeding time. Because these platelets are working on somewhere in the body, because multiple clotting happening in the body. So platelets are aggregated there. So free circulating platelets are less, leading to increased work. That is in DIC. Even in DIC, BT might increase. See, just a bleeding time connecting multiple conditions in the body, increased DIC condition. Or I will let you know another interesting thing. I will give you our best emergency protocol, very interesting. If a patient got a heart attack and they collapsed, definitely we can suspect patient blood was clotting. In this time, we can do one interesting thing. This thromboxane A2 can be blocked by a drug called aspirin. If you give aspirin to the patient, that will block the thromboxane A2. If thromboxane A2 block, platelet cannot aggregate. Without aggregation, platelet cannot activate. Without activation, they cannot convert fibrinogen to fibrin to clot the blood. So, in suspected heart attack patients, you can give some 5 to 6 aspirin tablets to them safely, because aspirin will prevent further clotting of blood. By halting the platelets, aspirin will block the platelet activity by blocking the thromboxane A2. See, they are interconnected. Have you understood the mechanism? So, in future, if you find any such issue, in nearby pharmacy, take one sheet of aspirin, give to them immediately. Meanwhile, when you are giving CPR to them, so you can extend their life. Yeah, this is overall bleeding time story. Understood, right? Yeah. So a simple bleeding time can give multiple signs in the body. Now tell me, students. Obviously, in case of pregnancy also, the blood volume will increase, cells will be less, volume is more, so there is a chance of bleeding. The first thumb rule for any surgery is checking bleeding time in the body. If patient was excessively bleeding, don't do the surgery at all. Before surgery, this is the mandatory test. If patient having excessive bleeding, don't do the test or don't do the surgery. You know the reason why. Why? What is the reason? You are cutting the blood vessels now and patient has less platelets. Increased prolonged bleeding and patient might die due to surgery. So don't do surgery if the patient bleeding time was more. Diabetes is a different story. Those sugar will do some things that I will let you know later. Okay? Diabetes story is as said. Yeah, apart from diabetes, there is one more reason where bleeding time might increase. That one was collagenomia. Simply collagen was deficient in the patient. If patient collagen was less, what happens? Bleeding will increase because collagen is the first thing that is exposed, where the collagen trigger entire reaction actually. So some patients naturally they have less collagen, leading to prone to these situations, right? So this is just a part 1 of my story. Now I will discuss part 2. Okay, now listen. This is just a tip of iceberg. Now again, gain your energy. Yeah, concentrate again, everyone. Methods of bleeding time estimation. Methods of BP estimation. Actually, I love hematology. These things are very interesting. I got one very boring subject from first year, that is called National Healthcare Delivery System, where I need to teach them Ayush. Getting an invitation. Oh, you also same batch, right? You come from college. Yes, so it is 3rd batch you are. So you have same curriculum, I know. Very boring, right?
Yes, sir.
Primary healthcare, secondary, national health mission, times, Ayurveda, yoga, yeah. Anyway, where am I? Methods of screening. There are 3 interesting methods. First method, most common method, that is finger prick method. Right now. finger prick method. So in this finger prick method, it's a straightforward test, a very simple test, but keep in mind how many things it is giving us, the data of the body. Yeah, finger test very simple. You will take your this finger, okay, I don't know the name of this one. So anyway, before pinky, right? Yeah, this finger. Yeah, so simple. You will take your stopwatch, okay, this one, digital stopwatch, 0, 0, 0, 0. Now very simple. You will clean the surface, you will take a sterile lancet, you will prick the finger and you will start the stopwatch. The stopwatch started. Okay. Now you will take a filter paper. A filter paper is just like a paper actually. Immediately after pricking, start the stopwatch and take the first impression on the filter paper. Just you need to impress, just you need to touch the surface. That's it. After getting your first impression, wait for 30 seconds. After 30 seconds, take the second impression. Here, definitely it will be small. Bleeding will be stopping. After 30 seconds, you will take third impression. At one particular point, you won't see any impression at all on the paper. That indicates your blood has been stopped, bleeding has been stopped. Maybe at here it stopped, so the time you will take 30, maybe around 0 seconds, 30, after 30 here, then here one more 30. So 1.5 minute. The normal bleeding time will be around 1 to 3 minutes. That is the test. Now students will do some wrong practices when you are doing bleeding time. Now what they will do? For every impression, they will squeeze the figure. Okay, they are expecting more impressions on filter paper. For every impression, they will squeeze and they will take. Again, you got the point, right? You should not squeeze. It's not MBO grouping where you will squeeze again and again. Yeah, this is called finger prick method, the most commonly used method in the lab. Clear? Now, there are some challenges. They are saying that this is not the right test to perform. There is an alternate test. Imagine my son is just 2 years old. Can you able to finger prick him? When we suspect something where we need to do bleeding time. His fingers are very small. We can't prick them. They might excessively bleed. What to do in this case for children? What to do? Heal. Even that is not safe. There is one more area. Earlobe. Okay. You will prick the earlobe. Start the stopwatch. Take the filter paper. Take finger, impressions from the earlobe. More safe than heel. Okay. From heel actually we can draw the blood entirely, but not this heel. Okay. Earlobe. This earlobe test is called as, imagine this is a ear. This earlobe test is called as, there is a scientist say this name, his name we are saying, Duke's test. In Duke's test we are collecting a sample from the earlobe. Simple. D-U-K-E-S, Duke's. Duke's test. What is the time, students? Today I took long lecture. Anyway, I'll continue. Next one. Now, I will test. These both tests are not standardized and they will give wrong results. Can you guess why? I'm saying that these are bad tests. They are not good. What might be the reason? Even my third test is manual by the way. Now guess. I will let you know. Imagine a children's blood pressure. What will be the children's blood pressure? It will be more actually compared to adults. Their heart rate also more. Or I will say, we got a patient has high BP and we have another patient, they have less BP. Right? And now we need to perform bleeding time. Of course, we know they have normal platelets, everything fine. We can go for this one. We have asked their clinical history, they don't have hemophilia, so we need not to worry. But coming to the hypertension patient, high BP patient, already his blood pressure is more. If you prick them, definitely the bleeding time will be more. Will you agree with me? Why bleeding time is more in BP patient? His BP is more, so more bleeding might happen. That doesn't mean he has a platelet deficiency. This is a blood pressure factor leading to a wrong result. Got my point? A blood pressure will give a wrong result. How to overcome this challenge? Can we say the patient that you should have a normal BP? Can they control their BP? It's not possible. Then what to do? How to control a patient BP to do the test? Any idea? Is it possible to control patient's BP, by the way? Manually? We are not gods or they are not saints, right? They are not sitting in Himalayas. So how to do this one? Very, very simplest technique. Take a blood pressure cuff and apply a known pressure value, maybe 40 mm Hg. Now once you apply 40 mm Hg, from here the entire blood vessel will have same blood pressure. We are standardizing a blood pressure by giving a purposefully a known pressure value. That is 40 mm Hg. Under 40 mm Hg, now in the forearm, gently prick, okay, with a lancet, but don't damage a large vein, okay. So gently prick the vein. Now the vein will start bleeding. You take your impressions on the filter paper. Definitely, this method bleeding time will be more compared to the other methods, maybe around 3 to 6 minutes. Okay, from method to method, the variations are there. So this might be around 3 to 6 minutes, and this is the most standardized method of doing bleeding time. Because here we standardize the pressure and we are taking. Irrespective of the patient, we will get proper value. Got my point? And this method is called as IVY method. And this is the gold standard method. And I don't think there is an automatic method for bleeding time. There are some very indirect approaches of doing it, but they are not standardized. I don't think they are reliable. For bleeding time, we only have manual options as of now. There is a machine called coagulometer. Coagulometer will check clotting time. It can also indirectly check bleeding, but there are some limitations. Yeah, this is all about bleeding time and the methods of performing bleeding time. Clear? So just quick revision. In what method we are using earlobe? In what method we are using forearm? What is the most common method? Can we able to squeeze the finger for every impression?
No.
What is the time interval between two impressions? 30 seconds. What paper we are using for this? Actually not a simple filter paper. It is called as Wattmann's #1 filter paper. There is a standardized paper that is called Wattmann's #1 filter paper. WHFPT, Wattmann's #1 filter paper. We already have here. Okay. Now with that paper we are doing this one. Then Wattmann's #1 filter paper. Okay. Next one. What will be the bleeding time in case of thrombocytopenia? Increase. If we give aspirin to the patient, what will be the bleeding time?
It will also increase because it will stop the formation of clot.
Tell me why, not right, correct answer. Why aspirin will increase bleeding time? What is the mode of action of aspirin? Aspirin will block the thromboxane A2 activity. What is the purpose of thromboxane A2? Aggregation of platelets. So here aspirin will block thromboxane A2, leading to absence of aggregation, leading to absence of primary plaque formation, leading to increased bleeding time. Okay. Yeah. what will be the bleeding time in case of 1 milligram factor deficiency? Increase. What is the role of 1 milligram factor? To activate factor A. One more role is there then. Tell me. Bind with collagen. Is it so? Yeah, obviously it will bind with collagen then. It will facilitate platelet attachment. 1 milligram factor will facilitate platelet attachment. Right? Absence of platelet attachment leading to a disease called as absence of platelet attachment or glycoprotein GP1B absence lead to a disease called Bernard-Soulier syndrome. Aggregation is facilitated by what receptor? 2B3A. Absence of this receptor leading to a disease called Gall's-Weiss thrombosthenia. Decreased platelet count is called as thrombocytopenia. Very good. Then leukemia. What will happen in case of leukemia to the bleeding time? Increase. What is the reason? Leukemia leads to cancer, lead to count will be normal cells will be reduced. Very good. What is the role of warfarin? What is the role of warfarin? Mode of action of warfarin? Very good. It will destroy vitamin K, leading to absence of vitamin K dependent factors. What are vitamin K dependent factors? 7, 10, 9 to 1 are vitamin K dependent. In case of hepatitis infection, what happens to bleeding time? Increase. In case of liver damage, what happens to bleeding time? Increase. Very good. Absence of calcium lead to increased bleeding time or clotting time? Absence of calcium, I said. Absence of calcium leads to increased bleeding time or increased clotting time? Clotting time will increase, not bleeding time, because that is clotting factor. Got it? Very good. What is the ideal method of doing bleeding time? IVY method. Most commonly used method? Finger prick method. Any more doubts in this? Clear, right? Yes, Melissa. See, I love you because you are giving easy sense. She's laughing. She's asking doubts. Yes, Miss Melissa. What is the role of 3A? 3A will facilitate attachment. Attachment is mediated by this receptor with a 1 milligram factor. So absence of this receptor lead to absence of attachment, lead to increased bleeding time. Are similar? Okay. Next, any other questions? Others? My beloved Pradeep. Pradeep, only one question, Pradeep. Stand up. Only one question. Simple question. What is the दूसरा naam of platelet? Platelet का दूसरा नाम क्या है? You don't know? Huh? Very good. Everyone clap for it. One more time. Very good, Pradeep. Now Riya will answer. Yes, Riya. What chemicals or what components secreted by platelet? What components secreted by platelet? Yes. is a clotting factor. What chemicals are secreted by platelets? I already wrote two chemicals. What? Anti. Ah, yes. What chemicals are secreted by platelet? Any other smart persons? GP2 is a receptor, glycoprotein receptor. Ah, yes, Melissa. Very good. Thromboxane A2 and ADP. ADP and thromboxane A2 are secreted by platelets. Arabia, what is this? I expected. See? Now Tapolo will answer. Yes, Tapolo. What will be the bleeding time status if we are giving warfarin to the patient? Increase. Bleeding time will increase or decrease? Yes. Yes, Taplo. It will increase. What is the reason? Why warfarin increased bleeding time? Previously I connected it. Previous answer. Who will answer this? Yes, Ria. How warfarin will increase bleeding time? She's trying to connect factor 8 to connect the bleeding time, right? Is factor 8 a part of extrinsic pathway or factor 8 is vitamin K dependent, by the way? Is factor 8 a vitamin K dependent clotting factor? No, right? So definitely it won't affect bleeding time. Got my point? So warfarin won't affect bleeding time. Warfarin will affect clotting time. Got it? But aspirin will affect bleeding time. Not warfarin. Warfarin is pure clotting factor, vitamin K dependent, and our 8 is not a K dependent, by the way. Got it? Yeah, keep in mind. Are you understanding the logics, whatever I am saying? Only if you connect with me since beginning, you will understand this. Next interesting thing. Apart from all these things, yeah, got it, right? Different pathways. Yeah. Next one. There is one interesting disease called Warfarin syndrome. Warfarin syndrome. I will let you know what is this. There is an athlete who is a running person on Olympics day. Not this time, 40 years ago. An athlete suddenly collapsed on the track. Once we came to know that after his death, he was died. We came to know that his aorta was blasted. It was bursted. His major aorta, okay, that was bursted. And we were surprised. And we came to know he was suffering with one of the rarest disease called as Marfan syndrome. In this Marfan syndrome, just like a weak balloon, plastic material was very thin. Once you are blowing it, it will blast, right? Similarly, the blood vessels are very thin. If their blood pressure increased, their blood vessels will blast. So this is called as thin the blood vessel disease. That is called Marfan syndrome. Now, guess students, in Marfan syndrome, what might be the bleeding time status? Will it increase or decrease? In Marfan syndrome, what happens to the bleeding time? Increase. Because blood vessels are easily rupturable. They are rupturing easily. So that is why a common definition that is wrote in this textbook was bleeding time is used to check the status of platelet activity, platelet function activity, platelet count, and blood vessel integrity. whether the patient blood vessel was constrict, rigid or not, whether patient platelet count is normal or not, whether the normal platelets having right activity or not, functional activity. All these things will be checked with a simple bleeding time test. Okay. Okay. Is there any more things to exaggerate the topic? Yeah, that's it, students. Clear, right?
Yes.
Thank you.
Thank you, sir.
Yeah.